During most colectomies, an 8 to 12-inch segment of the colon is removed, and the two ends are immediately rejoined, after which the operation is completed. This animation portrays the sigmoid part of the colon being removed and rejoined. Other segments of the colon can also be removed. When doing a right colectomy, a small piece of the small bowel is also removed, and the remaining small bowel is joined to the colon. This animation portrays the removal of yet another section of the colon that lies in the upper left side of the abdomen. Again, after removal of the diseased segment, the two ends are rejoined. There are two basic methods that can be used to do a colon resection. The first is to make a lengthy incision, usually in the middle of the abdomen. This is called the open method. The second way to do a colectomy is with minimally invasive methods, which avoid a lengthy incision by making 3 to 6 small incisions on the abdomen and placing airtight straws, called ports, through the incisions. Then the abdomen is inflated with carbon dioxide gas, which creates a working space. Next, a telescope or camera is inserted into the abdomen, which allows surgeons to see the inside of the abdomen. Long surgical instruments are placed through the other ports, and the laparoscopic operation is then carried out. Later, a small incision, 3 to 4 inches long, is made in order to remove the specimen. There are a variety of different minimally invasive methods. The goal of all of these methods is to avoid making a long incision. Sometimes it is necessary to bring a piece of the intestine outside the abdominal wall and create an external opening called a stoma. This is done to direct or divert the stool out through this opening and into an airtight bag that is placed on the skin. One reason to make a stoma is if the surgeon is afraid that the newly joined bowel ends are at high risk of developing a leak. A stoma is also made if the surgeon does not feel that it is safe to rejoin the bowel ends after a resection. This can be done with a small bowel, in which case it is called an ileostomy. If the colon is brought out through the abdominal wall, it is called a colostomy. Stomas are most often temporary. A second operation, approximately 2 to 3 months later, is required to close the ileostomy or colostomy. Before the stoma can be closed, a few tests need to be done to evaluate the colon. The operation to close a stoma varies depending on the type of stoma that was formed. Here, we see closure of an ileostomy. Here, we see closure of a colostomy. After the stoma is surgically closed, the patient will have bowel movements through the anus in the usual way. We deliver individualized patient and family-centered, high-quality care using best practice models across all disciplines. There are many people dedicated to your recovery process. Your surgical team includes surgeons, nurses, anesthesiologists, nutritionists, case managers, social workers, chaplains, physical therapists or occupational therapists, and home care services if needed. You and your family members are at the center of this team and active participants in your treatment planning. If you have any questions along the way, please ask a team member.